Hello, my name is Tisa Murdoch, Senior Product Marketing Manager for VMware. And today I'd like to talk to you about the Follow Me desktop solution for healthcare. This solution is really designed to help clinicians or caregivers improve their workflow while at the same time reduce the cost and complexity of the desktop for healthcare IT. When we talk about a clinical desktop solution, it's really important that we're able to meet the needs and requirements of both the caregiver as well as IT. And they're very different. So for example, the caregiver is concerned with being able to immediately access their desktops and applications as they move throughout the healthcare system treating patients. They need a very highly available desktop. Downtime is really not an option. And they need a familiar end-user experience. They do not have time to be retrained on a new solution. And then if we look at IT, they're concerned with how am I going to be able to cost-effectively and efficiently manage all of these desktops and applications. They need to be able to maintain compliance and security without inhibiting the productivity or the mobility of the caregiver. And they have to do all this with less money. Nobody has more budget today, and the healthcare industry is no exception. If we take a look at the existing clinical desktop solution, it's inefficient and complex. You have some medical applications being delivered over the network to a thick or thin client. You have some applications that are installed on that client device itself. And you have some applications that need a terminal devoted specifically to that one application because it can't coexist on a desktop with other applications due to compatibility issues. So as you can imagine, this is a very cumbersome workflow for the clinician. They have to first find the right terminal, log in, and then launch the application to get where they need to enter the information and data. It's also very complex for IT to try to manage this environment. They have to manage several application servers in the data center, in addition to hundreds or thousands of endpoint devices. VMware View can transform the static clinical desktop solution into a stateless virtual desktop that's completely untethered from a physical device. Using virtualization, we can separate the different desktop components. We can separate and isolate the operating system from the underlying machine or device. We can separate the applications from the underlying operating system. And we can further separate out the user data and settings, which we refer to as persona. We can then move these components back into the data center on servers or virtualized servers where we can manage them independently of each other. Then as the caregiver accesses their desktop, VMware View is able to dynamically assemble these components back together to present them a single, unified, and personalized view of their desktop with all their applications and data immediately available. And this is able to meet the needs of the caregiver because now the desktop's always up and running in the data center, so it's always available. And it's a very familiar experience for them because we're virtualizing a complete Windows XP, Vista, or Windows 7 environment. We're not modifying the applications in any way, so they get that same rich end-user experience that they're used to. And it's also able to meet the needs of IT, because now they're able to centrally manage all of their desktops and applications in the data center. They no longer have to be physically close to provision a desktop or an application. And all of this leads to reduced costs. They're also able to more easily maintain security and compliance because they're removing that data and information from that endpoint device, bringing it back into the data center where they can secure it and protect it and manage the access to it. It also provides a complete audit trail of who accessed what, when, where, and for how long, so it's easier for them to maintain compliance. With VMware View, the new caregiver workflow looks something like this. They simply go up to any terminal or device throughout the healthcare system, enter their username and password, or swipe their finger using a biometric device, or use a proximity card to tap in, and they're immediately presented with their desktop and their applications and their data. They can then go to another room or another floor or even another healthcare facility, repeat that process, and resume their desktop session exactly where they left it. And this is what we call the VMware View Follow Me desktop solution for healthcare. Thank you.